Bismillahirrahmanirrahim. Just a quick review for the monochorionic twin pregnancy. The timestamps very important. So once you have diagnosed, then how are you gonna know that it's monochorionic? How are you gonna diagnose at 11 plus 2 to 14 plus 1 weeks? You're gonna look for the chorionicity, right? You're gonna look for the chronicity. You're gonna do the combined screening test, and if she has not undergone combined screening test at this point, then you're gonna do a quadruple test. This is for the chromosomal abnormalities. Quadruple test at in the second trimester. But this is the best time to determine the chronicity. And then the surveillance starts from 16 weeks. Basically, we call it screening for TTS actually. So if they ask you when do you start screening for the twin transfusion syndrome, you will not know. You will know अच्छा हम screen भी करते हैं. No, that 16 weeks से जो हम scan करना शुरू करते हैं. You're supposed to start from scanning from 16 weeks, and you're supposed to do it every 2 weeks. Okay, every 2 weeks you're gonna repeat a scan. Even when everything is okay, because you're very high alert for twin transfusion syndrome. Okay. So now listen carefully. At 16, you're gonna start, and what are you gonna look at? We're gonna look at the DVP. Why? Because the first thing that happens in the Quintaro staging, stage 1, is the Leica abnormalities. There's oligo and there's poly. Okay, like imagine I'm cooking for someone. I'm cooking and cleaning and cooking and not eating myself, and the other person is eating and eating. And I'm cooking, then I'll get tired, and I'll collapse. The other person will also collapse because of overeating and over-consuming. You get it? So initially, there's just going to be oligo in the donor and poly in the recipient. Okay? And if someone hasn't watched my video, they're going to be like, Madam, it is no big deal. They're both twins are okay. And it's just oligo and poly. And oligo and poly is very common, right? We also see in single, but no, you're wrong. This is Quintaro 1. That is why you should know that oligopoly is Quintaro 1. And if there is a difference of 4 centimeter in the DVP of both twins, you're going to change this program from 2 weekly to 1 weekly screening. Very important. You are going to screen every patient via scan for TTTS every 2 weeks, but you're going to switch to 1 weekly scans when the DVP difference is more than 4 centimeters. Very important, okay? Otherwise, call her after every 2 weeks, okay? So the second thing you're going to look at during this scan, is the fetal bladders. Why? Because, cooking and getting tired and cleaning and working and not consuming anything, now bladder is going to disappear. The donor twin is slowly collapsing. The first thing is the bladder that's going to disappear. Over here you can see the Doppler abnormalities, how I mentioned. No, everything else is normal. So in stage 2 Quintaro, the donor's bladder disappears. Please remember that. So that's why we look at the bladders. The third thing that we look at in the scans is the Doppler. If there is how is the umbilical artery pulsatility index, how is the what else? Yeah, look at these things. Why? Because in Quintaro staging 3, there is either absent or reversed end-diastolic flow, or there's going to be reversed. What the hell? Brightness, or there's going to be reversed ductus venosus, or there's going to be abnormal pulsations in the venous umbilical venous flow. Okay, any of these things, and it's Quintaro stage 3. In 4, there's going to be hydrops. Imagine the recipient is going to be consume and then swell. And then in 5, there's going to be demise, of course. Both are going to die, or one of them is going to die. So at 16 weeks, you did a scan, you looked at DVP, bladders, the flow, you looked at the estimated fetal weight, you look at the discordance and SGA. These things, must comment. Then again, when we're going to call her after 2 weeks, 18 weeks. Then again, we're going to call her after 2 weeks, 20 weeks. On 20 weeks, one more thing is added in the scan. Also going to do MCAPI, the middle cerebral, very important. Why? Do we do this because we're going to look for the anemia polycythemia syndrome, okay? And then you just carry out this surveillance every 2 weekly, okay, from 16 weeks. But and then in 20 weeks, there's an additional one more parameter that you must see in the